Mild traumatic brain injury is common and occurs thousands of times a year. Here are some things you need to know. Number one, neuroscience has changed dramatically. 50 years ago, a medical textbook on the brain noted that even when a bullet passes through the brain, it may cause mild personality problems. Wow. 25 years ago, neurosurgeons themselves did not really believe in the concept of a mild traumatic brain injury. And finally, a leading neurological textbook as late as 1989 did not even contain the words diffuse axonal injury, which we now know is the primary way the brain can be injured. The lesson? We know now that the brain can be injured much more easily than we thought it could. Number two, no brain injury is mild. The categories of mild, moderate, and severe brain injury have been around for many years. We know now that even a so-called mild TBI can have a devastating impact on people's lives. Number three, no loss of consciousness needed. In the old days, it was thought that unless someone was knocked cold for several minutes, they could not even sustain a traumatic brain injury. Now we know that any alteration of consciousness, feeling out of it after an impact, woozy or weird, can be consistent with having had a trauma and brain injury. Number four, normal CT, normal MRI. Again, years ago it was thought a normal MRI or CT scan of the brain could actually rule out brain injury. We know now that's not true. We know now that some injuries in the brain are so widespread that they don't even show up on modern MRIs or CT scans. Number five, what is PCS? Post-concussive syndrome is a term used to describe a cluster of symptoms patients describe after head trauma: dizziness, headache, fatigue, memory problems, and irritability. Approximately 80% of patients will have these symptoms resolve 6 weeks after the injury. Number six, why doesn't everyone recover from a mild traumatic brain injury? Well, there are a number of factors that can be present that cause about 20% of people with a mild traumatic brain injury to end up with a long-term problem. What are those? A history of prior brain injury. B, a history of previous psychological problems such as depression or anxiety. C, a history of ADHD or some other learning problem. We're all wired differently. Some brains miraculously heal. Some, unfortunately, do not. Number seven, neuropsychological testing. What does this mouthful mean? If you're having continuing symptoms such as problems thinking or poor memory, you can ask your doctor about undergoing what we call a neuropsychological test battery. It's an all-day test, but at the end of it, it can show what your areas of strengths and weaknesses are in your ability to think. And finally, number eight, MRI, SWI, and DTI. What do all these letters stand for? What they stand for are powerful new types of MRI which for the first time can see into the brain like never before. What do they stand for? SWI stands for susceptibility weighted imaging, which is extremely sensitive to the detection of microhemorrhages which can be caused by trauma. DTI stands for diffusion tensor imaging and is very sensitive to white matter damage deep in the brain, which we've never been able to see before. So if you have continuing symptoms, don't be afraid to ask your doctor about these wonderful new technologies.